Hello everybody, my name is Andrew and today I will be presenting on the topic of compassion as a theological and public health concept. I hope you find it both enjoyable and informative. Compassion is an interdisciplinary concept that serves to recognize the suffering of others and a desire to take action to alleviate it. The Oxford English Dictionary defines compassion as the feeling or emotion when a person is moved by the suffering or distress of another and by the desire to relieve it. Compassion has been shown to play a vital role in the fields of theology and public health, respectively. Compassion in both fields share certain commonalities and possess their respective strengths in its application. However, neither discipline tackles all facets of compassion and therefore arguably demands a more synergistic and complementary relationship between the two fields. So this presentation really aims to review and synthesize the available literature on compassion from both a theological and public health perspective, summarizing and highlighting the strengths of its implications within each field, reflecting on their respective pitfalls, and provide additional context for further potential study and consideration of a joint approach using the spiritual nature of compassion in a healthcare setting. In examining texts such as the Old and New Testaments of the Bible, compassion is vividly depicted as a defining aspect of God's character. The Old Testament describes God as a compassionate and loving entity, who is slow to anger and quick to forgive his people even if they partake in sin. As an example, in the book of Exodus, God responds to the cries of the Israelites suffering amidst their slavery in Egypt by means of their liberation. The Old Testament also greatly portrays God's compassion through his tendencies to give second chances, whether they are deserved or not. For instance, in the book of Jonah, Jonah ignored God's initial calling, found himself in great peril, and was saved from certain death. In his survival, God calls out to Jonah a second time, who hastily heeds his word to preach the word of the Lord to the people of Nineveh, who subsequently repent, resulting in God moving to spare the city from destruction. It is important to note that God's compassion is a covenant to his people as a law of the Lord, and an expectation of his followers to demonstrate the same level of compassion toward others. In the New Testament, compassion takes on the form of Jesus Christ, who was sent to fulfill the law of the Lord on behalf of the people. Jesus is shown to regularly demonstrate compassionate behavior toward all, with an emphasis on those who are suffering or neglected. As an example, in the parable of the Good Samaritan, when a Samaritan took notice of an abandoned individual on the brink of death, he catered to his needs out of sheer selfless compassion. Jesus relays this tale as a lesson of practicing compassion toward others, no matter the circumstances. Additionally, the Apostle Paul describes compassion in relation to God's unwavering love. One example is noted in Paul's ascension to the heavens, during which he observed the judgment of souls firsthand and prayed for God to show mercy to tormented souls, and God responds by granting these souls a day of rest every Sunday. This experience serves as a twofold purpose: a means of discouraging sin while also reinforcing the idea that God's mercy is a constant force, even to those who may be undeserving. Compassion is also a prominent value and a foundation for different religious traditions around the world. In Buddhism, compassion is a central and crucial aspect believed to be essential for promoting both individual and social well-being. Buddhism greatly utilizes the concept of karuna, which focuses on a sense of universal oneness. Buddhists express compassion through empathy and concern for the welfare of all living beings, paying close attention to the presence of suffering. Buddhism uses the Four Noble Truths to recognize suffering, identify its cause, determine an end goal to address it, and take action to alleviate it. Compassion in Christianity is viewed primarily as mirroring God's love towards all humanity and the life and teachings of Jesus Christ. Christianity employs its followers to enact similar behaviors as Jesus through the expression of compassion toward others in the hopes of promoting a more compassionate society. Compassion from a Christian perspective is about being more forgiving of others, expressing love, and habituating prayer to maintain a strong relationship with God. In Christianity, the term agape typically refers to love and compassion, which speaks to the root of God's compassionate nature and how it is manifested in Jesus. Like Buddhism, compassion in Hinduism incorporates the universal oneness of karuna, but also focuses on the concept of dharma to create a strong spiritual connection. Dharma loosely relates to a sense of righteousness, with compassion being the clearest path to righteousness that contributes to an individual's dharma. Linked to this idea is also a spirit of non-violence, or ahimsa, which utilizes compassion as a means of embracing ahimsa by abstaining from aggression toward all living creatures and instead prioritizing love and care. Like Christianity, compassion in Islam is viewed as reflecting God's mercy, or rahmah, on people and is essential for creating an inclusive and harmonious society. The concept of rahmah is meant to mirror a similar level of God's mercy so that humans may enact the same compassionate traits within their respective communities. Compassion in Islam is deeply linked to the belief of God's interconnection with all life and is carried out through acts of charity, forgiveness, and kindness. Self-compassion is also a vital theological component of compassionate behavior on the individual level for its promotion of greater spiritual connection. Practicing self-compassion is a means of becoming more self-aware and being less judgmental of the self, and ties into the idea of embracing vulnerability and being more self-accepting. Through being more forgiving and compassionate towards oneself, people tend to feel more connected with others and with God, and consider themselves more worthy of God's grace and mercy. It is through practicing self-compassion that individuals can keep themselves open and free, which serves to create a more effective model of compassion toward others. Moving into the health aspects, compassion from a public health perspective goes beyond the scope of being kind towards others or taking pity on someone's medical situation. More accurately, it requires a greater understanding of individual patient needs and perceptions when it comes to the care they receive. Compassion in healthcare is widely accepted for its physical and mental health benefits for both patients and healthcare workers alike. When it comes to the patient, a compassionate health practitioner is essential for providing the best level of care to optimize health outcomes. Compassionate care has been associated with factors including accelerated recovery times, reduced pain levels, and lowered rates of hospital readmissions. Patients that receive compassionate care tend to report higher satisfaction with their care for being made to feel validated and supported. In addition, self-compassion is also found to be a key factor for overall patient well-being, with benefits that include lower levels of stress, anxiety, and depression that is often associated with the need to seek medical care. Self-compassion also encourages patients to partake in healthier behavioral choices and avoid activities that are otherwise detrimental to their health. Similarly, healthcare workers can also benefit from practicing compassion and self-compassion. Burnout is a concept understood as a depleted willingness or desire of a healthcare worker to continue in their position, typically a result of a multifaceted dissatisfaction with their work. Healthcare workers that receive training in providing compassionate care to patients tend to have lower levels of stress and a lesser likelihood of experiencing burnout. Compassionate care training for healthcare workers is also associated with improved stress management, communication skills, and emotional self-awareness to bolster the ability to provide quality care. Healthcare workers that regularly utilize self-compassion tactics tend to have better job satisfaction, supplemented by a greater feeling of accomplishment, and are less likely to leave the field due to being overwhelmed or underappreciated. To minimize and ultimately prevent detrimental factors to patients and employees, strategies and programs can be put into place that encourage compassion as a routine part of healthcare and work culture. One effective approach is through the implementation of compassionate care initiatives, which aim to develop policies and procedures to prioritize the delivery of compassionate care to patients. Initiatives can include a variety of different trainings and workshops geared toward advancing the ability of healthcare workers to practice compassionate care. The content of these trainings would ideally pull in input from multiple parties, including clinicians, nurses, physicians, families, and even from patients, to provide an additional layer to the discussion and design of such initiatives that most accurately focused on the needs of the patient. Current initiatives and programs tend to allow for elective participation in these trainings, suggesting that it may be necessary to incentivize or mandate participation. As such, incorporating greater compassionate care training during initial healthcare education could help address the elective nature of these initiatives. In a literature search aimed at determining the presence of empathy and compassion in medical education, about a third of qualifying results did not contain accurate or significant discussion of the importance of compassion in education. This would suggest that there is a need to incorporate compassion as a routine in healthcare curriculum. Promoting a compassion-based education program can aid healthcare professionals in developing the skills and attitudes most appropriate for providing stellar compassionate care from the start of their career, thus eliminating the need for mandates or incentives to encourage participation in trainings. The incorporation of compassion into public health interventions is critical for its increased acceptance by healthcare professionals and the general population alike. A popular approach is to capitalize on promoting greater empathy and understanding among healthcare providers and the general population through appropriate public education. For example, focusing on the key takeaways and experiences of people that live with a particular health condition or disease could allow public health leaders to create stronger public health education campaigns aimed at encouraging compassionate and empathetic outlooks from providers, patients, and the general population. Additionally, incorporating compassion into public health interventions can assist in tackling health disparities by focusing on the social determinants of health, especially in underserved communities. By addressing factors such as poor education, poverty, and access to healthcare, public health professionals can more effectively design programs and interventions that target some of the root causes of health disparities. Through making patients feel more supported and cared for, compassionate approaches to public health work to increase patient satisfaction, decrease rates of readmission to hospitals and health clinics, and improve their health outcomes. As amply demonstrated by reviews of both perspectives, the theological and public health considerations of compassion resonate greatly with the goal of addressing suffering in the self and in others. Theological implications of compassion involve a more spiritual approach to coming to the aid of others through the uplifting of individuals and harmonizing communities, whereas healthcare prioritizes the effects compassionate care has on human and community health through different physical interventions. While both approaches have their respective strengths, however, each also lacks critical factors in their application that the other may otherwise provide. While theology emphasizes on the spiritual and emotional aspects of suffering, it does somewhat lack in the physical, objective aspects often associated with healthcare, such as the onset of disease, data collection, and medical interventions. Theological compassion does not incorporate evidence-based practices in intervention, whereas public health greatly utilizes data and research to gather relevant information to create the most effective interventions to address different dimensions of health. Additionally, theological compassion incorporates the idea of moral responsibility when it comes to both general and health outcomes. Public health takes a broader approach to this point, focusing more on the social determinants of health such as poverty, poor education, and access to healthcare as leading causes for health disparities. The public health implications of compassion are more concerned with objective medical issues than its theological counterpart. While this approach is certainly essential in medical care, it does lack substance in terms of addressing the spiritual and emotional aspects of an individual in need. The benefit of compassion from a theological sense brings in the idea of a more holistic healing process, something that objective medicine in a healthcare setting would inherently be lacking. Given the known association and benefits linked to a spiritual and compassionate approach to health, public health can fall short in addressing care that encompasses all aspects of health. Since both focuses have factors that the other does not, it cannot be said that one approach is superior or preferable to the other. The areas in which both fields are lacking can be viewed as a kind of trade-off between the two disciplines, suggesting that there is room for convergence for a greater good. Since the theological aspects of compassion are primarily based in historical and religious origins, its contributions are arguably more concrete and likely less subject to regular changes. On the other hand, the realm of public health tends to evolve more quickly, influenced by tangible factors such as medical developments and social demand. After considering the shortcomings of both fields, two education-based suggestions for the future of public health practice come to mind: spirituality in health education and spirituality as a public health issue. Arguably, the most important step in incorporating spirituality into healthcare is through including spiritual training in nursing and medical education systems. Although it has been demonstrated that spirituality and health have a positive relationship, there is still a need for greater willingness and implementation of spiritual care in treating patients. Research shows that there is ultimately a lack of proper education and guidance on spiritual nursing practices and a non-standard definition as to what spiritual care would entail. Given the international acceptance of the benefits of spiritual care, it seems somewhat redundant that it is not an integral part of education and treatment regimens. Fortunately, the willingness seems to be less of the issue, and healthcare practitioners just need an improved means of knowing how to take spiritual action to aid patients. Additionally, addressing a lack of compassion in spiritual care as a pressing public health issue can help better tackle its lack in practice. Promoting increased partnerships between religious and medical sectors can work toward addressing public health as the need for improved public health systems increases. Incorporating healthcare efforts bolstered by experts on faith and spiritual healing yields greater promise when addressing known social determinants of health. While some joint organizations do currently exist, widespread implementation can only serve to supplement their efforts, especially when catering to more underserved communities. These organizations can potentially drive educational campaigns aimed at providing greater public awareness and acceptance on the importance of spiritual incorporation of compassion for its benefits of improved health. This approach can inherently extend to patients and families to be better geared for showing appropriate support during times of medical crisis. The commonalities of compassion in the scope of theology and public health is a direct contradiction to the popular claim that science and religion cannot coexist. In reviewing the historical origins in the most current academic research, the role of compassion is a critical force that is arguably underrated and requires greater widespread understanding and implementation. Compassion is accepted as a means of promoting spiritual connectivity and health, while also promoting physical and mental health in individuals and in communities. While there is more extensive discussion on its complementary efforts, there is still significant room to further combine the strengths of compassion in a theological and public health perspective, especially since their respective shortcomings can seemingly work together. Through increased education efforts on the importance of holistic health and support from the necessary entities, spiritual care has the potential to become an integral part of modern medicine and public health practice to maintain a sense of faith in an evolving world. Thank you for taking the time to watch my presentation on compassion as a concept of theology and public health. I hope you found it both insightful and enjoyable.